Hi and welcome to Pre-Vet Shortcuts. My name is Marvin Munzu and I'm one of the managing directors of Pre-Vet Shortcuts. I'm also the clinical tutor. So very excited today. Very quick video for you. The reason why I'm doing this video is because many Pre-Vet students still are not very clear or need more information about sick day rules. And one of the reasons why this is important is because personally, I don't think the BNF covers enough when it comes to sick day rules, and most of the time, you probably get more information from the Diabetic UK website. But I'm going to give you guys some of the key rules that you need to at least be aware of, so that if this comes up in your exam, you will smash the exam. So here's what we're going to cover very quickly in this video. We're going to look at the definition of sick day rules. We're going to look at what happens if you fail to implement the rules. We're going to look at the aims of sick day rules and what medicines need to be stopped temporarily. So especially for type 2 patients, what medicines do they need to stop, such as metformin, when they're actually not feeling well. And then also when to refer for further medical attention. So it's important that you know that when diabetic patients are not well, then there's a high risk of them having hyperglycemia, so an increase in blood glucose levels. They could also have hypo, but generally in most cases, we're looking at an increased raised blood sugar level. So let's look at definition. So what is the definition of a sick day rule? So it's just a guidance that helps diabetic patients manage the condition during periods of stress, periods of illness, periods of infection, periods of trauma, vomiting, and diarrhea. So that's what happens. So normally when you have any of these periods, any of this infection, diarrhea, vomiting, stress, then that's going to affect your blood sugar levels. Therefore, it's very important that blood glucose is managed effectively during these times. So, what happens if you don't take this seriously, or what happens if you don't follow the sick day rules as a diabetic patient? Here's what's going to happen. So, what we're trying to prevent is if a diabetic patient is not feeling well, maybe they've got an infection, and they do not follow these sick day rules, or you don't provide them the guidance, then there's a risk of them getting, number one, diabetic ketoacidosis. And this is covered in so much detail on our combo course, diabetic ketoacidosis. The second thing they could get is acute kidney injury, and then finally hyperglycemia. So the main aim of the sick day rules is we're trying to avoid them getting any of these. Reason being, any of these diabetic ketoacidosis, acute kidney injury, hyperglycemia are all very urgent conditions that require urgent hospital admission. So we're trying to prevent that urgent hospital admission by making sure that diabetic patients, especially type 1 diabetic patients, have sick day rules, a guidance to help them to know what to do on days of sickness. So the aims of 6-day rules are the advice we give the patients or type 1 patients is, number one, manage or monitor glucose levels, monitor ketones if present, manage regular medications. So there are certain regular medications such as your metformins that you have to stop taking them when you're not well temporarily. So we're going to look at those medications later on. You need to ensure adequate calorie intake, specifically your carbohydrates, and also a lot of hydration. Dehydration could lead to a lot of kidney injury. It could also lead to problems with the kidneys, and in other cases, diabetic ketoacidosis. You need to be able to recognize or to advise patients when to recognize times to get further medical attention. So that's exactly what we're going to cover. So let's look at sick day rules, and I'm going to give you a good mnemonic or a good acronym that can help you to remember the essential things to advise patients on sick day rules. So the first thing is this is the acronym for you. It's SICK. That's a common one that's used. S is for sugar. So the first thing they need to monitor is the blood glucose. The difference between type 2 and type 1 patients is they both have to monitor blood glucose, but type 1 patients monitor glucose more. So every 2 to 4 hours. Also, the second thing is insulin. There are many patients that think that because they don't eat, then they don't need to use insulin on those days or those times when they don't eat. But this is not the case, because although your blood glucose does rise when you eat something, there are also many situations where glucose increases even without food naturally in your body. So you need to always make sure that you never, ever, ever stop your insulin on days when you're sick. The C is for carbohydrates. So we're looking at a very good carb intake, but also maintenance of hydration. So say for instance, if you have a high blood glucose, then we'll advise you to drink hydration drinks that don't have sugar. So sugar-free fluids. If you got low blood sugar, then we'll advise you to have sugary fluids. And then finally, ketones are very important, especially to prevent ketoacidosis. So ketones also have to be checked every 2 to 4 hours, just like your glucose. Drink plenty of water to flush out these ketones from the system. Stay hydrated, and you also give extra rapid-acting insulin in addition to normal insulin during times when patients have ketones. So these are the main ones. SICK, a good acronym for you to remember, a good mnemonic. So I'm going to show you what drugs need to be stopped temporarily. So the drugs that need to be stopped temporarily, a good mnemonic for you is SAD-MAN rules. So this is not exhaustive, but these are some of the main ones that could potentially come up in your exam. So SAD-MAN rules, S is for SGLT2 inhibitors, such as your canagliflozin. With all of these, we're looking at dehydration. So we want to prevent dehydration. That's why you have to advise diabetic patients, especially type 1 diabetic patients, to stay hydrated with those sugar-free fluids. So your SGLT2 inhibitors, dehydration could lead to DKA, diabetic ketoacidosis, which is covered again in much detail on the combo course. This is just a taster, nothing in relation to the quality and the quantity that you get on the course itself. So ACE inhibitors, that's what A stands for. Again, dehydration with ACE inhibitors leads to AKI, so your kidney injury. With diuretics cause dehydration. That could also lead to acute kidney injury. Metformin could lead to lactic acidosis, which is one of the side effects of metformin. So dehydration with patients that take metformin could lead to lactic acidosis. ARBs, such as your losartans, dehydration could also lead to kidney injury. And NSAIDs, like your ibuprofens, dehydration could also lead to kidney injury. So you see, it's very important to keep diabetic patients hydrated during periods of sickness. So these are some of the medications that you stop temporarily, and then once the blood sugar level is back to normal, and once the infection or the stress on the body is gone away or is fine or that's been resolved, then you could go back to taking your medications as normal. So it's also important that you know or be able to advise patients when to seek further help or when to get further medical attention. So for example, pregnant women, persistent vomiting and unable to keep fluids down. So persistent vomiting, you definitely need to refer those patients. Any sort of drowsiness, breathlessness, acute abdominal pain. If the condition worsens despite following the sick day rules, then they need to be referred for further medical attention. So that's in a nutshell. Not everything, this is not all exhaustive, but some of the key things that you need to know about sick day rules have been highlighted here. And if this comes up in your exam, then you have a very high chance of using this information and still getting the questions correct. And also advising, once you become a pharmacist, in practice, you'll be able to also give this information to diabetic patients when they're not feeling well. So thank you very much for watching this video. Please like the video. If you found this information useful or helpful at all for your revision, please give the video a like so that more students can see this video. And also this is feedback for us to know whether to produce more videos for you. Subscribe to the channel so that you'll be notified whenever we post new content. We're going to post content frequently. And then finally, I'm going to put a link in the description, which is just an absolutely free link for you to join our free mailing list. And the advantage of joining the free mailing list is you get daily questions, clinical and calculation questions, Gphc style up-to-date questions and answers. You're going to get this for quite a number of days, and it's all free. So if you're interested, just click on the link in the description, join the free mailing list. Don't forget to like the video if you found this useful, and I look forward to seeing you soon. Good luck in your exams, good luck in your revision, and believe in yourself. Thank you. Bye.